Hi, and welcome to Health 3600. I am Dr. Tiffany Vickers. I am the professor for this course, and I am really excited that you have all decided to take patient navigation. This is a really interesting course, and if you're interested in healthcare, this is a great way to introduce you to all of the facets of healthcare. There's so many different places to work in healthcare. The point of this course is to sort of help you understand what a patient navigator does, the settings they can work in, and how they help support patients in achieving positive health outcomes. So you might be asking yourself, okay, well then what is a health navigator exactly? And a health navigator is a professional who focuses on the patient's needs. And this can include things like guiding patients through the healthcare system, working to overcome obstacles that are in the way of patient-required care and treatment. Patient navigators are also responsible for helping organizations. So you might be employed by an organization and you might help them with scheduling, managing patient appointments to ensure that they receive timely services. You might facilitate communication among the family and the patient, or the patient, the family, and the provider. So there are a lot of ways for patient navigators to step in and really help ensure that patients have positive experiences with the health organizations they're interacting with. So that's kind of in a nutshell what a health navigator is. All of the work that you'll be doing this semester in this class will help you to understand what the role of a patient navigator is, how they assist patients, and where you might work if you decide that being a health patient navigator is something that you want to do when you graduate. So I want to start by showing you, let's go through the syllabus first, because I think that might be a really good place to start. So begin by going through the welcome here. You'll see my welcome message and some information about navigating the course. And so navigation is here, using Canvas, that sort of thing. Then the next is all my contact information. So I have an open door policy. You're welcome to email me or call me anytime you'd like. My email is my preferred communication. I'm really quick with my email. You're welcome to stop by my office. I'm in HPC 304, and you can swing by and stop by if I'm in. I'm happy to chat with you. The other thing I offer are Zoom meetings. So if you'd like to meet with me by Zoom, just shoot me an email, let me know, and I can send you a scheduling link, or I can just hurry and put something on the calendar. So just let me know what it is you'd like to do when you want to meet with me. And then just some information about me, a little bit of my background. And then here we have on this next screen is your introduction discussion. And this is so important because this is our first introduction to you. So go in, tell us a little bit about you, your name, maybe what you're studying. If you have interesting hobbies that you want to talk to us about, share that information. Throw up a couple of pictures or a video, whatever you feel comfortable sharing, and let us get to know you. All right, so let's go into the syllabus now. All right, a couple of things. Be sure you go through all of these in depth, read through them, make sure you understand them. There's one thing that I want to be sure you understand, and that is that you will need this textbook. It's important that you purchase the textbook. And the reason for that is we do a lot of case study analysis in this class, and all of the case studies are contained in the book. So you'll want to be sure you have access to the textbook. Otherwise, it will be really challenging to complete the assignments. All right. The next part of the syllabus is the learning outcomes. These are the learning outcomes for the course. And if you are in the population health, if you're one of our population health students, these are the things that you will gain at the time you graduate. The skills, I should say. Grading is listed here. When you look at this, so if you're wondering, oh, what does an 80 earn me? It would be a B-. The projects and assignments that you complete in this course are weighted, so no one thing can completely blow you out of the water, which I think is kind of nice. But the final project is 20%. Module projects are 30, assignments are 40, discussions are 10. And then the late or missed work policy is here. You do have to notify me if you are going to be late with an assignment, a discussion, any post of any kind. If you're going to be late and you notify me before the due date, you have a 1-day grace period to get it submitted. After that, if you are 2 days late, you will receive a 5-point deduction plus any deductions for errors in the assignment. And then on the 3rd day that it is late, you'll lose 7 points and you will no longer, and you will have to have informed me that it was going to be late. On day 4, if you're 4 days late, that's the cut point. You can no longer submit after you're 4 days late. So just be aware of that as you are approaching your assignments. All right. Expectations and requirements. Watch these videos. They're important. You may have seen them in other classes, and if you have, then go ahead and skip them. It's if you've seen it before. There's some information here about computer and digital literacy, but the thing I really wanted to point out here is the help desk. If you have any tech trouble, you have trouble submitting to Canvas, whatever it is, either call the help desk or use the help function here in Canvas so that you can get the assignment submitted. Okay. And then on the final page of the syllabus, we have some resources listed. If it will advance, I will show you. Here we go. Learner support. All sorts of good information in here. And if you have a need, if there's something you need, let's say you want to talk with somebody in career services about your resume, you can click on this link and it will take you to the career services website and it will direct you to someone who can help you. All right, now I want to go into the mod. Well, let me start by showing you the announcements. Okay, so pour over the syllabus, take a look at that. I'd also like you just to be aware of the fact that I use announcements to communicate with you when there are changes, when there are neat opportunities that have come up, when there are employment opportunities that I think some of you might be interested in. Sometimes I'll post in announcements. If due dates have changed, sometimes I'll post announcements there. So be really mindful of your announcements and your emails coming out of the course and adjust your Canvas course notifications so that you get those in a timely manner. All right, so I want to jump into the modules really quickly. Modules, this is where you'll navigate. You'll navigate everything from your modules. You can come in here and you'll begin by going into the module 1 overview page. Each module is structured this way. This will tell you what is expected in this module, what you need to complete, the project, and then you have a module review. The module project is helping you to build toward the final project. So everything you learn in this project will help inform whatever you do in the final project. So pay attention to the feedback that I give you on these projects and all of the assignments that you're getting. I will offer you feedback in 2 places. In the body of the assignment, if it's a written paper, you can go into the assignment and click on view feedback, or in the comments box. Sometimes I'll leave feedback there. So those are the places where you can see that feedback. All right. The other thing I want to talk with you about is the final project. And in this final project, you are going to have 2 choices for how you complete this. Click into the project, the final project, the final assignment. You'll see here that option 1 has you writing a 5-page paper in APA format using 5 scholarly articles to support the paper that you've written. Or you can complete option 2, which is identifying a healthcare organization within your community, and then you can volunteer for a minimum of 4 hours to observe. You do have to be there for 4 hours. I need to receive an email or some sort of confirmation from the person who hosted you. And then I need a reflection describing what you did, who you worked with, whether or not there's a patient navigator currently working there. So just read through these instructions, but be aware you have 2 choices, but you might want to start thinking about that right away so you know what you're going to do in the assignment. Okay. The other assignments that you have are just varied and they have assorted due dates. So just make sure you come in and pay attention to these due dates. The late policy applies to all of these. Okay. So, and then the other thing, if you are unsure how to write a paper in APA format, I have included in our announcements a link to Purdue's online writing lab. They have a great writing lab, and I'm just going to click in actually. And let's make sure that my screen is showing you what I want you to see. Here we go. So I have taken you right to an example paper, an APA sample paper. And it's a student paper. And if you scroll down here, it will show you exactly what the paper should look like. So focus on the student paper. You can expand that if you'd like. And then this will give you all sorts of guidelines for what should be listed here. And then how you list in-text citations. And then it will walk you through. Oh, it's not going to let me scroll that quickly, but then it will walk you through what your reference page should look like. I strongly encourage you to look at this because APA formatting can be a little confusing unless you've done it before. So take a look at this and make sure you're familiar with it because it's important. Okay, so that is that. So if you have any questions for me, please reach out early. If you're struggling or you're sort of spinning and you're just kind of at a loss, hurry and reach out. I'd love to hear from you, and it will be much easier on you and me if you just reach out early and ask questions if you have them. Okay, I'm looking forward to getting to know all of you a little bit better, and you have all my contact information, so I'll see you on Monday.